Hello everyone. I hope that you all are doing fine. I'm a bit sick, so my voice would be a bit different today, but that's fine. And we will start with our today's 5 pages. But before that, I just want to share a few things. First of all, I understand that you guys are concerned because the ADC has released the new competencies and they mentioned that they would be following them from the September. So, what you need to do is rather than getting panicked, you just need to be more prepared and read about them. Try to understand that because if you are in Australia, you must know that life in Australia is very difficult and it's very stressful. There is a lot of thing happening, like lot of patient, even not even patient, like lot of person, even you go out you will feel that they are very rude to you, and it's because life is bit tough. Okay, so they want you to um, understand and they want you to be ready for them. So that's the reason they implemented these things. So what you need to do is, if the patient who comes with you and who comes to you and he's bit angry or frustrated, you just need to uh, make sure how you would deal with him. Okay, and if you are suspecting that the patient is sorry, he is experiencing domestic abuse, then in that condition what you will do, they just want you to be prepared for all these circumstances. So I have shared some references from the ADC, a reference only from the ADC News Bulletin. So those are on my Instagram handle. I'll share the link. You guys can read it. I found them really helpful. Maybe you could also get an idea and get a point like what they actually meant about that. Okay, and we will be continuously trying to search, and if I found anything else, then I would definitely share with you. But do not panic, just get more prepared. Sorry, I got like very bad cough, so that's the reason. And that's okay. So we'll start with today's pages. Management of patients reporting hypersensitivity to penicillin. So if in the last pages we read that if you are suspecting the patient is allergic, first you need to ask the history, then you need to refer him to the for the test. Okay, so now they mentioned that how will you manage them if after the test they are positive, like they are allergic. Managing a patient who reports hypersensitivity to penicillin depends on many factors. Consider whether antimicrobial therapy is necessary. Then consider whether it is really important to prescribe the antimicrobial therapy and the balance of benefits and harms. Okay, so if the details of the reactions are not clear, take a clinical history to determine the nature and severity. So first you need to consider whether giving the antibiotic therapy is really a good good reason. There is a this antibiotic would really help the patient or not. Then you need to if the details of the reactions are not clear, then you need to ask the history which we read in this box. So you need to ask these questions to understand the nature and the severity of the reaction and how it was managed and whether the patient knows if other antibiotics have been tolerated. So they are just repeating that thing, that if you are not sure, then repeat these questions again to the patient. One common scenario is a patient reporting a childhood history of penicillin allergy that is unclear. In this situation, keep in mind that many childhood rashes associated with beta lactam antibiotics are caused by a viral infection or a drug virus interaction rather than true antibiotic allergy. These reactions are rarely severe and patients can potentially be rechallenged. So generally what we experience is the patient comes and he would say, when I got this antibiotic when I was younger, I got the rash. And the symptoms are usually very unclear. So in those cases, usually when you re-challenge the antibiotic, but only under the specialist guidance, you should not be experimenting by yourself. You should always take advice from the specialist. I think my throat is very bad today, so let's see how many pages I could do. Otherwise, we will continue from tomorrow. Although it is not possible to give clear guidance to cover all situations, Figure 2 provides a guide for generalists to manage some common penicillin hypersensitivity scenario in which a beta lactam. So here they have given this table in which if the patient is allergic to penicillin and there is a need to give only the penicillin, then we would be what you need to do on those circumstances they have written here. This is a simplified summary of a complex field. The antibiotic expert groups recognize that there are regional variations in how penicillin hypersensitivity is managed, and that specialists may choose to manage their patients differently after weighing up the benefits and the harm. When selecting an antimicrobial in a patient with penicillin hypersensitivity, it is important to understand how R1 side chain affect the risk of cross reactivity between beta lactams. Alright, so if the patient is allergic to cephalosporin, then we need to seek the expert advice. But if the patient is allergic to penicillin, then what we can do? First of all, we will read the common scenario, like the most easy scenario in which the history of non-immune mediator, like patient said, when I took the penicillin, I got diarrhea or I got GIT intolerance. In that case, it is definitely safe to administer penicillin. You can give it and remove the penicillin allergy from the patient's medical record or annotate the true nature of the reaction, because this is just the normal pharmacological effect. This is not an allergy, right? So the second scenario is in which patient reports that he is allergic to penicillin plus he is allergic to cephalosporin as well, and it is immune mediated. Then do not prescribe any beta lactams except for azithromycin. Only azithromycin is the drug that you can prescribe, antibiotic that you can prescribe, or refer to specialized antibiotic allergy testing center. Okay, then if the patient reports that when he took the penicillin last time, he had the immediate, it means that the anaphylactic reaction, then you would read like you need to find out, was it immediate severe or was it immediate non-severe. Immediate severe would be anaphylaxis. Immediate non-severe would be only the rashes or the urticaria. Okay, so in if the patient has got severe reaction, then do not prescribe any penicillin or cephalosporin. There is only you can prescribe aztreonam. Okay, and can consider carbapenem. Uh, Before we will discuss in detail this box, I just want to make clear that we won't be using this table anywhere, because in any scenario, if the patient would say that I am allergic to penicillin, you should prescribe him the clindamycin. But this box is just only for your general knowledge. We won't be using it, but just for you can read about them. Okay, so if he has got the severe reaction, you can only prescribe aztreonam and can consider carbapenem. Okay, so if he has immediate non-severe reaction, then do not prescribe the penicillin but can prescribe cephalosporins. Avoid cephalexin and cefaclor patient with amoxicillin and ampicillin allergy. And You can prescribe carbapenems and aztreonam to both of them. Even here also you can prescribe the aztreonam. And if a penicillin is essential, perform desensitization in a non-urgent situation, then you would refer him for the tests. Okay. Same for here. Like if the patient has got immediate hypersensitivity, first you need to find out whether it was severe or non-severe. If it was severe, you can only prescribe aztreonam or carbapenem and refer him for the testing. If the patient has got non-severe reaction, then you do not prescribe the penicillin, but you can prescribe the cephalosporins. Okay, and can even prescribe carbapenems and aztreonam and then refer him for the testing. But if the patient has got the delayed reaction, then ask him whether it was severe or non-severe. If it was severe, then do not prescribe any penicillin or cephalosporin. You can only prescribe the aztreonam. So the aztreonam you can prescribe in every situation. Okay. And yeah, and then but for the delayed, you need to make sure that you would not be asking him for the desensitization, because we read it here as well. Do not perform direct oral challenge without prior skin testing in a patient with a history of severe antimicrobial allergies. And this work is for the specialist and the hospital thing, so you do not need to worry about this thing. Okay, but if we got the delayed non-severe reaction, however, yeah, avoid penicillin, but you can prescribe cephalosporins and carbapenems and aztreonam. In short, all these boxes are bit similar. What you need to ask him, like, what was the type of your allergy? If he would say that it was like GIT intolerance, then you can just prescribe any penicillin. Okay. If he says that he is allergic to penicillin and cephalosporin, then do not prescribe any beta lactams, but you can prescribe aztreonam. Okay, and then refer him. Then if he says that he had immediate allergy, then you need to find out whether it was severe, non-severe. Then in severe cases, you can only prescribe the aztreonam. In non-severe cases, you can prescribe the cephalosporins and aztreonam. In delayed, you need to find out whether it was severe or non-severe. For severe cases, you do not prescribe penicillin and cephalosporin. You can only give the aztreonam. And for the non-severe cases, you can try to prescribe, you can avoid, sorry, you need to avoid the penicillin. However, in a non-urgent situation and under specialist guidance, consider a single dose, like the desensitization you can consider, but it is only under specialist guidance. And safe to administer, you can prescribe the cephalosporin and carbapenems and aztreonam. Okay, so the next page is the cross reactivity between beta lactams. So I would say that we would continue this from tomorrow, because I'm not really feeling very well today. And second thing, I just want to ask you, I do have Apple Pencil, but it does not really work on my HP laptop. It works well on my iPad, but on iPad, I cannot really record everything. So I'm not sure, like, is there any way can I use my Apple Pencil on my HP laptop, or do I need to really buy a new one? If you guys know anything, please let me know. Okay, and thank you so much for watching my video. I'll see you next time.